Hello, welcome to the Dental Handoff. I'm Dr. Kelly Tanner, and today I have Shana Iacovino with me. Shana, welcome to the show.
Thank you so much. I am so happy to be here.
You guys, Shana has an amazing story. I know that you guys are on here to learn all about the different roles of each dental professional, take the highlights out of what it is that maybe you can learn and apply to your life. Shana, why dental hygiene?
So, why dental hygiene? I actually knew, I was just talking to somebody about this the other day. I knew when I was very young that I wanted to go into the dental industry.
Mm.
I wanted to be a dentist when I was about 5 years old. My mom remembers as well. I remember sharing it with my class. And then as I got older, um, I just gravitated towards dental hygiene for whatever reason. When I was in high school, I was like, all right, it's dental hygiene school. Here we go. And the rest is history. So I'm just super excited.
What about it attracted you?
I think helping others. Ever since I was little, I just enjoy helping others and helping others learn something new. So
Hmm.
educating them. Um, I have an older brother and a younger brother, so I always supported them and helping them, especially my younger brother. And I think that's kind of what gravitated me towards it. I enjoy teaching, mentoring, coaching.
Yeah. So you graduated, and then, I mean, I see your credentials. If you guys are watching on YouTube, she has a credential that's a public health dental hygienist. It's a public health dental hygiene practitioner. And I was curious about that because I'm like, okay, what do you do that's different than my state in Virginia? So tell me about how all this started, like from clinical to where you are now and some of the lessons you learned.
Absolutely. So in hygiene school, you go to rotations, so different sites to see patients, different patient populations, whether, age, all of that. So I truly enjoyed this one site. It was a public health facility serving under, low income individuals and families. And I enjoyed the people that worked there, the patients, just the feeling you got out of, you know, providing them a service and them feeling so appreciative that we took the time to educate them, let alone perform the service. So, and I think with my personality, just enjoying helping others already, that just, I knew I wanted to go right into public health. So, one of my mentors in hygiene school, she, was working with me frequently, especially in second year. And she was like, we've talked about it. There's actually an opening where I work. And she was like, I'm happy to offer you full time. Like my director already, I supported you and she's all in, come in for an interview, just like a meet and greet. You already have the
Yeah.
job, but let's do a meet and greet. We did a meet and greet. I started immediately once I got my dental hygiene license, and I was there for 2 years. I enjoyed it very much. I learned a lot, especially right out of hygiene school.
Hmm.
You learn a lot restorative wise with patients, perio wise with patients. And it was a great experience. It was just very far from my house. And I was at the beginning of my marriage and we wanted to have children, start having children. So that kind of led me into something closer to home. So I was able to obtain, at least in the state of Pennsylvania, you need a certain amount of hours to be working under a dentist to receive this license. So the public health dental hygiene practitioner license. So I applied for that, received that. And then I did move into private practice at that point, and I enjoyed it. However, I enjoyed public health even more. So I went back to a public health facility that I actually was one of my rotations in dental hygiene school. And that was the mobile dental unit that I ran for my local county for underserved families.
Very cool.
And that was just, it's great to kind of lead any operation, let alone something you're passionate about. So for me
Yeah.
to go in 4 or 5 days a week and manage this unit and these patients was super empowering. I had a great director at that point. She was very impactful on my career because I met her in dental hygiene school, and then I obviously started working for her at this site, and it was wonderful. And I needed that license to work
Yeah,
at that facility because I did not have a dentist. Um,
gotcha.
yes,
So
day
you
in, day out, but
so, like, pausing just for a second, kinda rewinding a little bit, you got your start at because someone was looking out for you, someone was
mhm,
mentoring you.
yes.
Is that what I was hearing you say?
Absolutely. So, the best advice when I'm speaking to young, even if they're already licensed or dental hygiene students, I'm actually speaking to a class today. The best advice would be to identify a mentor, find someone, and even if they can't get you a job, it's just someone. And I still speak to my mentor from hygiene school today. I still rely on her to bounce ideas off of. Does this sound like a good idea? Is this beneficial? Do you think, this is a good idea? And she's still wonderful. She's a great support system. And I encourage everyone in dental hygiene school or at a dental hygiene school to find one or any. It doesn't matter. Any profession, you need mentors. You do
Yeah.
with
Yeah.
experience, knowledge, and that's honestly kind of what put me on my path that I am today are
Yeah,
my
that
mentors.
that insight and I I think, also too, what is fascinating is because I think everybody has got a story about where they are today based on what someone saw in them.
Correct.
Right, and I think that's
Yes.
what happens with our mentors, and it's so empowering because you're like, "Wait, you see that in me? How me? Little old me? How does that even come up for you?" And then they describe how other people how they perceive you, how you are in the world,
Correct.
and how you're showing up, and it's validation for who we are, you know?
And it yes, and it gives you that sense like, "Okay, wow, I'm not that I'm doing something right, but I'm doing well at something, and I could probably do even better if I, continue to be a team player, to continue to provide support to even my colleagues or, just bounce ideas off of." It's always all of the mentors I've encountered have been positive, empowering. It's never like, "No, you can't do that. Nah, I wouldn't do that. I'd wait." It's taking those risks, but it's
Yeah.
changing. It's not, it's a risk, but that's life. Like you have to take risks. You go with
Yep.
your gut. That's also another thing. Go with your gut. And I've done that with my career in hygiene. I'm like, all right, I'm gonna make this move. And it was always for the better. Every move I've ever made has been beneficial to me, especially for where I am now. And it keeps you moving, which is wonderful.
Yeah, not taking a risk is taking a risk
Yes.
because
Right?
you risk staying exactly where you are, exactly who you are, and not growing, and I don't know that was the intention for our
Correct.
creation to live in our gifts.
I agree. Like, if I'm plateau, then I'm like, all right, I need to change something. I need to I need to read an article about something new so I can, identify if it's beneficial, like anything like that. Yeah. So I've been in dentistry, like I said, 15 years, and I feel like I've worn many hats and grown in a lot of ways, personally and professionally, because I think that that rolls over, the personal and professional. So,
It certainly does.
yes,
So that mentoring that you had, and then you ended up
yes,
with another mentor
yes,
with the mobile teledentistry
yes,
unit. So, wow, and I know that you were teaching someone there somewhere in there too, right? You were an
yes.
adjunct
So throw
faculty
that in
member.
there. Yes.
And so you had mentoring at that level.
Yes.
Okay.
So I started teaching about 5 years ago, and it was adjunct. It was nice. I was teaching at where I graduated from at Harcum College 1 day a week. It was great to connect with second year dental hygiene students. It's just something about others for me. others learning things that when you see them have that light bulb and they're like, "Oh, I get it."
Yep.
And I'm like, "Yes!" And you just celebrate, and that's the best thing, and that's what I do right now. I'm just doing it with clinical licensed hygienists. So, I'm providing support, clinical support for them to not plateau, to not, be in a rut, like, to show them that there's growth, like chair side. Like, I'm here to show you that growth personally and professionally. Whatever goals you may have, that is kind of what I'm supporting and coaching them on.
Yeah. So it sounds like your that mentoring, you really took it to heart, and that's
Yes.
impacted who you are today and how you
Mhm.
actualize it for others.
Yes. It absolutely impacted my life. And she knows that. We've talked about it. The mentor from hygiene school, she has worn many hats too, similar growth path. She, would be in a position and then she would grow and she would then move on to the next growth opportunity for herself. And she's been an amazing support system. I feel like I've been very fortunate to have, you know, a handful, which I feel like is a lot of
Mhm.
mentors
Yeah.
that were very successful in their career, whichever path they chose, because they all have different paths. One's, an educator, full-time educator. The other one is with, a large dental organization. And the other one was a director of this facility for a very long time. And now she is now retired. But yeah, like they all provided something different. The director at the facility, she provided me with that operational management experience, which obviously you don't get in education so much. So that was very beneficial because she was
Mhm.
running the dental clinic. And obviously, then I was um, operating and managing the dental mobile unit. So, yeah, that's where I received my support from her. So,
So right now, day to day, you're supporting
yes,
hygienists where they are clinically in a lot of different levels. What are some of the
correct.
so I know that, it's working with so many across many offices. How many
Yeah,
offices do you work with? 20,
24.
24. I was gonna say 26.
Yes.
You work with 24 offices with all the hygienists, the teams across. What are kind of like the top things that you support the hygienist with? And like, I guess, having my own coaching and mentoring group, I do group
Mhm.
coaching, I do mentoring. We have a Facebook group. If you guys
Yes.
go on over there and check it out. But what are some of the top 2 things that people come to you and say, "Shana, I really need this," or that you
Yep.
know that
So, top 2 things are effectively, um, having that conversation with their patient about certain services. Top 1, periodontal disease. Just feeling comfortable, educating the patient and making sure we're heard as clinicians and providers, but also making sure the patient is understanding what we're saying to them. Another big topic is oral cancer screenings, is trying to train them and coach them to obviously we're not diagnosing, but we're screening.
right?
That's a big part of our role as now that's very prevalent in our society. Those are our big two initiatives and the two questions I'm always getting support, clinical support questions for.
Because 'Cause I'm sitting here thinking too, as I teach my courses
Hmm.
internationally, I'm
Yes.
thinking about the questions that I get a lot, which go along with, like, coding, staging, and grading, but a lot of them come down to, how do I talk to my patient about this? What do
Hmm.
I say when health becomes disease? What do I say um, when we're finding something the patient wasn't prepared
Yeah.
for? Because I think a lot of times we're so scared to tell them that they have something. Is that what you're finding too?
Yes. It's It's almost like they're asking, "Am I allowed to say this?" When they went we all went to dental hygiene school, they're licensed hygienists, it's just how do I effectively say it to my patient for them to understand the severity? And like, we need to treat this now. This is not something we need to delay. Like, this is important. I care about you. And that's exactly what I tell the hygienist. And I've said to my patients, I'm like, we have to take care of this. This is active infection. This is active disease. We need to treat it. And this is our option. This is what we're gonna do.
Yeah, and then the patient who and then, like, some follow-up questions I got from this past weekend was, what happens if the patient ju like, if the doctor supports and says,
Correct.
"Let's just do the D1110 today, and let's see
Yes.
how it responds." Like, how do you respond to that? How does the hygienist respond to that?
Yes, and believe me, that happens more often than we would like. So
Yeah,
that is where I come in and I provide support, whether it's one-on-one support with the hygienist and then one-on-one with the doctor, and then we follow up as a team. Sometimes it's as a team first, and then we do a follow-up with the doctor and then the hygienist. So it just depends upon the dynamic in the office, and we figure it out from there.
'cause I
But
think
yeah.
with that type of scenario, Shana, that it's more like the culture and aligning the doctor and the hygienist, and so what I even say and recommend is back it up a step further. When you are interviewing for a practice you wanna be a part of, you should be interviewing about the culture,
Correct.
not just the 1, 2, threes of it, but
Mm.
also what are you about? How does this practice walk, talk? How do you be?
Yeah,
And how do you wanna where's your place in that, and do you align? But there are sometimes too that folks are interviewing think that it's a certain way, kinda like any other relationship that we have.
correct.
You go in and it's like, "Surprise, that's not really what it was like."
Yeah, we don't do that here, and you're like, "Okay, that's not what I was told, so now what am I gonna do?"
Yeah. So what is some advice, like, if you have a gap in culture, what would you recommend? What would be, like, the first recommendation? I know this is a broad stroke because it's dependent on every single
Yeah,
situation,
no.
doctor, and nuance, but how would you approach that or guide a hygienist to handle that?
So, I would guide the hygienist. This is kind of common, this theme, is I usually guide the hygienist, like, we've been educated, to a certain extent, so we know, um, perio disease. That is our expertise. That is what we're treating day in and day out. I encourage you or empower you to partner with your doctor to have an open, honest, respectful conversation as to why you think we should do it this way and then see what your doctor says. Cuz more often than not, they're going to support you. Majority of the time they are going to support you
Yeah.
because this is evidence-based research, perio disease. So like if you come with facts, it is hard to argue with that, you
Yeah.
know? And then you have some, the small few, very small percentage who are just like, "Nope, I've done it this way, we're doing it this way." And you have to identify if that's someone you're willing to work for and continue doing what their philosophy is. And if you're okay with it, then that's up to you. If
But
you're not,
your license is at risk.
correct.
There was an
So,
individual there was an individual who said to me, "Well, the doctor says it doesn't matter because 'cause they're not gonna it doesn't affect my license, it only affects theirs." I'm like, "That's not
not
true."
true.
No,
You
they're
can
gonna
be
go
called,
the patient's gonna go for the deepest pockets first, but did you
correct.
can be sued civilly
Yes.
for that.
Yes.
So
Exactly.
stand your
So,
ground, stand in what you know is the whole takeaway from this, and if you need help guiding the conversation, connecting with doctor, aligning, but at the end of the day, if your philosophies don't align, then is it the right fit for you?
correct. Is this going to work? Are you okay with not, supporting your own beliefs just for this role when you could find someone that empowers you and supports you and day in and day out? There's
Absolutely,
yes, there's
absolutely,
yeah.
and that goes for anything in life. Don't
Exactly.
don't
Like it
settle,
does.
don't
Yes.
settle.
Don't settle.
Yeah,
Yep. You're right.
because, also too, I mean, the hygienist is very sad because they come to me and they're like, "I really wanna do what's right." But then doctor and hygiene will align on it, and then okay, here's something that I've encountered, is that we're aligned. This is when I'm coaching because I coach dental practices, and I'm observing and being there to support hygiene like you are, but in a different role, and I'm going in and the hygienist is doing what they know that it passes the litmus test in hygiene school, right?
Yep.
So they're doing the things. Doctor comes in and says, "It's been like that for 20 years. Let's just keep watching it." And, like, they know the systemic I mean, I get knowing your patients. I honor
Correct.
however, and we don't know what's going on systemically so many times, and it is a red flag for us because to say we can do better than this, than just watch it because the body is trying to tell us something.
Correct. There our bodies exactly are telling us something, so let's take care of it. I understand it's been this long and it's been like this, but that's our role as a dentist, dental hygienist to support our patient. If we see something going on, we have to say something. We just do.
Yeah. And so in that situation, what I have recommended for hygienists to do, because it happens sometimes like real time, right in front of the patient, is
Yep.
to obviously not bring it up and be confrontational at that moment because that's not the place for it.
Correct.
Obviously ask for a meeting with doctor and say, "Listen, nothing is wrong. I wanna have an alignment meeting with you so we can just align on some things because I just wanna make sure we're on the same page in terms of our treatment and what we're saying in front of the patient," because it's and then leave it at that and see what the best time to meet with the doctor is. And then, um yeah, if it keeps happening, well, in that
Correct.
situation, if you're talking about scaling and root planning, the doctor comes in and says, "We're just gonna keep doing the D1110s," or whatever they say. Yes, you do have to decide what you're gonna do. That day, what do you do? I mean, what
Right.
do you do? I mean, and I tell people, "Look, listen, I'm under the direction of my doctor, and I make a careful note of it in the chart. The doctor discussed this, patient informed of this,
Correct.
doctor was okay with blah, 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 blah. Sign your name right after it. Hygienist said this, doctor said this, patient understands the risks. Not that it lets you, not that, I mean, even signing a form of saying that you're denying treatment, it doesn't hold up in court. And a lot of people
Correct.
don't realize that.
I
So
know. I
put it
know the
next to your
fact
name
that
and then do not put them back on your schedule. Doctor can
yep.
see them.
Yes, I agree. And have that conversation. That's what I'm is the biggest hurdle is having that conversation now. And I feel like we're not having that conversation because yes, this is our doctor, it's our dentist. Yes, we are linked to them, we're employed by them, but we should also feel respected. We were also trained we just need to be more comfortable having those respectable conversations with our doctors. Have that synergy alignment meeting to be like, this is not quality care. We're not doing what's best for the patient.
Yeah, because if there are also multiple hygienists in the practice, it's not
Yeah.
just happening to you.
Hmm.
And so think about the exponential effect of what is happening. So it was funny the other night. I was sort of thinking about this because this is what we do, and something dropped in my mind. I was like, wouldn't it be cool to just like have an app where someone could ask questions, not AI, but like a real person to give advice, like what do I do if the doctor doesn't blah blah,
Yes.
and to have someone tell you real time, well, in that instance, make your note about this and do this and do this. And this is just professional guidance. It's not, you need to know your own state laws. But how cool would
Yes.
that be to have something like that?
That would be perfect. So ideal. Because when I was first, which most hygienists just out of school, you're like, okay, my doctor said it. That,
Yes.
this is what I'm gonna do. And you do it. Listen, I've done it. And it's okay, but we do need that empowerment. So whether it's within yourself, somebody in that office, just to feel like you can speak up and say,
Yeah.
I really think this patient will benefit from scaling and root planing or whatever it may be.
Right. And it's not empowerment for the sake of the power
No,
for the listeners. That's not what we're getting at here. It's
no.
feeling like you have something that that you have that sense of worth in you to know
Yeah.
that that's what's best for your patient, because when you put the patient at the center of it, you can never go wrong.
Yes.
It's when we don't do what's right when that gets in the way. So have the conversation, maybe lead a hygiene meeting,
Yes.
bring that to the forefront. I always tell hygienists, when you go to meetings, when you go to study clubs, whatever that is, bring it back to the rest of your team and say,
Yeah.
how can we do this together? Because it's about the we go together. It's not about the ego. It's about the we
No.
and that.
Yes. Yeah, this is a team effort. All of
Mhm.
this is a team. And that's I definitely try to reiterate that because I it's that support, it's that culture, it's that feeling a part of something. You're like, "Wow, okay, I can speak up in this team meeting now," whether it's a hygiene meeting or, doctor hygiene meeting, just a hygiene meeting or an office meeting. Like, "Okay, I feel safe. I feel like I
Yeah.
have support here. I can say this." Like, because I've seen patients for how long and I know what may be, best in this scenario. So, yeah, it's that support. It's that feeling like you're being a part of something and you're safe too. Like no
Yeah.
one's going to judge me for what I'm saying.
And I feel like too, when you have a space where hygienists can come together in a practice, whether it be in one small practice, collaborate in that way and talk about scenarios like, I saw Mrs. Jones, I did this, doctor said this, what would you guys do? So just alignment between each other to know how the right hand is working with the left hand. So again, it starts with us. It starts with us and knowing our worth, and that
Yeah,
it's our responsibility and we're accountable for bringing that to everyone's attention, right? But then how are we doing this together? And how is that aligning with the care that we say that we want to provide for the patients that we signed up for with the patients to then better the health of our communities who are surrounding us?
exactly. Like our goal, as we know in hygiene school, is to promote good oral health, to bring our patients to optimal oral care. So we need to kind of get back to that because I feel like we do sometimes once you've been practicing, you're like, yep, I'm doing great. Like this is, wonderful. Is it? Are we doing what's best for the patient? Are we at optimal care at this point? Some may say yes, and some might be. Some practices may be, but others aren't. So it's just like you said, know your worth. Know you do have a voice to speak up. And if you don't have that where you are right now, consider it if it's the best fit for you.
Yeah, talk to your mentor. Talk to your
Yes, talk to
mentor
your
about what
mentor.
they would see.
Biggest
It goes,
advice.
"Boop," and then if you don't have one or you don't know how to seek one, look, you have some
Yeah.
right here.
Yes, exactly. Like, and the best thing is I did get involved with, the local dental hygiene association, obviously in my state right away. That is something that I just and you network. You
Yes.
get to know people and it's a small community and now I see them, 10 plus years later at the same, conventions, conferences and it's just they could be one of your mentors or just somebody you can run something by. It doesn't have to be, something as big as a mentor or anything like that. Make it what you want, but definitely, reach out to fellow colleagues. That's
For
the
sure.
biggest thing. Yeah.
Yeah, be around people who build your support network.
Yes.
Your support
Yes.
network. Shannon, thank you so much for being on today. This insight for your day to day and your experience is so unique and how you brought it together. So thank you for all the lives that you touched and all the things that you do.
Thank you so much for having me. I am very happy to be on here today and speaking with you. So I appreciate you.
Thank
Thank you.
you. It's an honor. Well, if you guys want to hear more from Shana, there is information in the show notes, which are the notes right below this episode. You have a way to reach out to her if you want direct mentoring, whatever it is that you want for Shana. You got questions, burning questions? Do that. I know that she would
Yes.
love to help you and be that mentor to you. And for all of my listeners, subscribers, thank you so much for your support. You all know that I always ask the favor of going to Apple Podcast and giving the Dental Handoff a 5-star rating. If you're watching this on YouTube, please go ahead and like this episode and subscribe right now. Go ahead and press the subscribe button so it recommends our podcast to other people who may love it just like you do. Thank you, everyone. We will see you next time. Thanks, Shana.
Thank you.